To kickstart our interview, Dr. what is your take on the President's address this afternoon?
So first and foremost is to say that the first thing that a decision had to be made with regards to our current situation of COVID and balancing and taking into consideration the effect of COVID on the healthcare system and the economy. So the decision made is quite a wise decision. It gives the country an opportunity to actually test our preparedness with regards to COVID-19, of course. And I'm saying this because we know that the cases are on the rise. And so this gives the opportunity for us to actually test our level of preparedness as a country with regards to COVID-19. It also puts it upon the people and us as a country to be able to take responsibility, as the President had said, in terms of civic responsibility, that we now need to also make sure that we adhere to the mitigation measures. This is a phased reopening. The movement, of course, has been allowed, and it poses a risk to transmission of infection. But, of course, the transmission of infection will only occur if we do not put on our masks, we do not sanitize or wash our hands, we do not observe physical distancing. So basically, it gives us an opportunity to see how we are prepared as a country in reality. In the next 21 days, there'll be a review of how our infection rate is, yes.
Dr. do you say it was a sound decision?
Yes, it was at this point in time, given the fact that you're not just looking at the healthcare system, but you're also looking at the economy that has taken quite a hit with regards to economic activities and all that. So, yes, a balance had to be struck at some point. Locking down people restricting movement in and out of the capital would have led to perhaps even severe reactions from the people. And so at this point in time, remember this lifting of restriction of movement is conditional. That in the next 21 days, there'll be observation on the cases and how the cases progress. And then a decision will be made with regards to whether we will go back to the lockdown or not. But I think the most important thing here is that as responsibility also equally.
And with that said, Dr. is Kenya's healthcare sector ready for a spike if we have if we see the numbers continuing to rise?
In reality, we are not. I wouldn't say we are 100% ready, and this is because our healthcare system and our healthcare sector has been underfunded, chronically underfunded over the years since independence, in terms of infrastructure, even in terms of human resources for health as we speak. And we anticipate that, as we anticipate the surge also, that now it's been over 3 months since that directive to hire more healthcare workers. And we hope that this will actually be actualized and see more healthcare workers on the ground being able to combat COVID-19, not just COVID-19, but even the other illnesses that are equally affecting Kenyans. So this will be the opportunity to now know where the gaps are with regards to strengthening our system to be more robust.
Terry, how far are the counties with their 300-bed facilities in each county in preparedness of handling COVID-19?
In reality, we are not yet even up to 20 counties. We are less than 20 counties ready. And of course, then that makes it, the counties now need to take up this responsibility of ensuring that they protect their citizens in the counties and ensuring that they beef up capacity in the county, not just infrastructure, but even human resources, testing, contact tracing. Even the home-based care that we've embarked on needs more additional human resources for health. So all these need to be put into consideration now. So the counties have much more to do now as opposed to 3 months ago, because then the phase in which we're currently in with a very steep rise in the curve, then counties now do not have any other option but actually put in place what is required to be able to combat a surge in the number of cases.
Terry, then let's also look at the status of the health workers. As far as we're concerned, there's been more than 100 health workers who's been infected by the coronavirus and 2 fatalities, if I'm not wrong. So what is the current situation as we speak, even as we venture into the lockdown, which has been uplifted?
Yeah, so yeah, the figures you've given are correct. I agree that healthcare workers have been infected, and the numbers keep increasing, and that now shows that there's more need for provision of personal protective equipment across all the levels. We normally have level 1, 2, and 3. Level 3 is for those confirmed COVID-19 cases. But as we speak now, any patient walking into a facility could actually be COVID-19 positive. Even asymptomatic patients are a risk in terms of transmission to healthcare workers. So that means that the effort of provision of PPEs needs to move to level 2, and which is the provision of N95 masks, goggles, and surgical gowns for the healthcare workers, so that they're able to protect themselves much more. Of course, the issue of welfare of the healthcare workers now needs to be finalized with regards to insurance, with regards to payment. When you lose a healthcare worker, then they leave behind a family that needs to be taken care of. So all these things that now there's no more time to lag and say that we are still trying to discuss and come up with a conclusion. These are things that need to be put in place immediately without much delay.
Okay, and Dr. as you wind up, any advice to your fellow Kenyans or your fellow health practitioners or even the world at large?
Yeah, so to Kenyans, first and foremost, is that lifting of restrictions and allowing movement does not mean that COVID-19 is behind us. In fact, we are at a position where we are seeing a very high increase in the number of cases of COVID-19. So to Kenyans is to protect yourself, protect your family by putting on masks even as you move around, washing your hands, observe social distancing, and avoid gatherings. And in reality, go out only when necessary, because the reality is that the infection is among us. It's spreading within the communities that we live in, and you just don't know. Even your close friend could actually be a patient and who could be transmitting it to you. So that's the most important thing for Kenyans to do. For healthcare workers, we shall keep ensuring that we serve Kenyans where we can. But even with that, we need the support that needs to be put in place. I think these are issues that we've discussed several times, and I've even mentioned them today here. The issue of welfare package for the healthcare workers, employing of more additional healthcare workers, and basically is that we are yet to get out of the woods. We still have a pandemic amongst us, and it's important that we take the necessary precautions for us to be safe and be able to open our country fully.
Okay, thank you so much, Dr. for giving, or for always giving us your time, by the way.